Amidst a triple threat of respiratory viruses, the flu, RSV, and COVID-19, Thunder Bay's medical officer of health says COVID is the one she's least worried about. But Dr. Janet DeMille notes she's just as concerned about the overall state of the healthcare system now as she was during the height of the pandemic. On the same day that Health Canada officially declared an influenza epidemic, Thunder Bay's medical officer of health says that virus and RSV now concern her more than COVID-19 does.
There are children who are getting both infections.
And it's those youngest members of the population that Dr. Janet DeMille is most worried about as hospitals battle this triple threat of respiratory viruses.
Children under the age of 5 are at the highest risk right now, and that's what the health system is dealing with. It is babies, newborns, babies under 6 months who really can't even get the vaccines, right? The flu vaccine or the COVID vaccine.
On Monday, Ontario's Chief Medical Officer of Health said this.
I'm strongly recommending that all Ontarians, not just those at high risk, wear a mask in indoor public settings.
But Dr. Kieran Moore stopped short of reinstituting a mask mandate. And while Dr. DeMille says in a perfect world a mandate, particularly in schools, may help, she appreciates the political challenges that would have presented.
It has become a very polarized issue, the whole concept of mandates. Unfortunately, even masking, which is a very small thing overall, has been quite polarized.
But she hopes people will heed Dr. Moore's strong recommendation and mask up. And she's urging anyone who's sick, even parents, to minimize contact with children if at all possible.
Don't hang out with young children if you're sick or if you have any symptoms or if you're recovering from something. And certainly wearing a mask if you're around those kids. And that includes, anybody in the household, because it can happen that a parent will give it to their child, or, it happens vice versa, or the siblings. So really protect those that are most vulnerable, which is that younger age group.
DeMille is also encouraging everyone who can to get the flu shot and the bivalent COVID vaccine.